Hey team, it's Dr. George Forgan-Smith. I am a gay and kink-friendly GP based in Melbourne, Australia, and I have been asked to answer some questions for Thorn Harbour Health. So the question that I have is, what happens to HIV viral load if you become infected with the coronavirus? So this is a really tricky one because we don't actually know. Absolutely, people living with HIV have been infected with the coronavirus, like with the amount of infections in New York, in China. Clearly, people living with HIV have been infected. Now, in and of itself, living with HIV does not increase your risk of infection with coronavirus. If you're a smoker, if you have existing lung disease like severe asthma or COPD, that does increase the chances of infection. But when it actually comes to what will happen in the body, we can't 100% know for sure. And the reason is that we're just not quite seeing the data yet about, we're finding people who are living with HIV who have been infected, but we don't yet know what is happening to their CD4 count as well as their viral load. Now, we know that the cases of coronavirus or COVID-19, the disease caused by coronavirus, can be very mild all the way to very severe. And that seems to depend on how deep into the lungs the infection goes. But I think we could imagine that if a person was to get very unwell, that there could be changes in their viral load. But I think at that point, the medical teams are going to be really concentrating in on care of the person, getting them through this particular phase of the illness. So I think this one's a watch this space. We don't 100% know. However, if you're living with HIV and you are worried about coronavirus, things that you can do as the exact same thing that we're recommending for absolutely everybody. Wash your hands frequently. Before your hands go anywhere near their mouth, please wash your hands with soap and water, or at a minimum, an alcohol-based hand sanitizer with at least 60 to 70% alcohol content. Social distancing. If you have to go out and about in public, staying at least 1.5 to 2 meters away from other people can reduce your risk of infection. And staying at home as much as you can will help reduce your risk of COVID-19 illness. Of course, I've done videos on this, and at the moment, hooking up is not an advisable practice. Intimate contact is how the virus is spread, and you don't get much more intimate than having sex with other people. Now's a good time to get texting, to be writing sexy SMSs to people, maybe exchanging photos or video chat. These are great options at this point. It's not ideal, but it's not forever. And we will get through this together, but we have to work together on this one as well. I hope that was helpful. I wish I could give you a clearer answer, but this is what we have at the moment. Have a good one, stay safe, and look after yourself and each other.